for them. And again, yeah, thanks for the presentation. That was great. It's nice to see all these West Coast programs with your West Coast flair on here. I wish we had your weather, and I wish we had your beaches. So with that, thanks very much, Stanford. And do we have? Yep, I see UW. You're on top of it. All right, the floor is yours.
Thanks. Can you guys all hear me okay? Great, thank you. Let me get our presentation going here. Good evening, thanks so much for joining us. We really look forward to sharing some of our program with you tonight. I'm Dr. Jennifer Zumstag, I'm the Residency Program Director. This is my 4th year now as Residency Program Director, although I've been at UW since 2005. So it's definitely home, and not planning on going anywhere else. So I want to welcome as well Karen Ennis, our Residency Program Administrator. She's on and listening in and here if we have questions, but wanted to make sure that you also heard from our residents. So there's some links in the chat box, and then our website is just uwpmnr.guide, and there's definitely updates coming every day, so stay tuned to that, but we've already got a lot of good information. I'll share some additional documents with you at the end, and appreciate you being here tonight. It's a stressful, busy time, but it's also really exciting to have great interest in PM&R, and we appreciate you sticking with us, whether you're here in real time or virtual later. Alrighty, so from my perspective, I just wanted to touch on some of the top reasons I think it's worth applying to UW PM&R and having some additional opportunities to review our program. You'll hear more about some of these specifically from the resident perspective, but we have a broad set of training experiences, really with the ability to come here and then do whatever else you're interested in residency, which can be helpful because while there's a lot of different things to do in rehab, sometimes people have that figured out in their R4 year or their MS4 year, and usually they're not quite sure. So it's great to have that breadth of training experience. We are a hospital-based program for all of our inpatient rehab units, and so that means that we take home call, and we have that hospital-based system as backup. We are part of a very large University of Washington graduate medical education program, and there's more than 110 ACGME accredited residencies and fellowships. So we have a lot of other infrastructure and support to help us out, which is great. We have kind of unusual didactic structure that's more course-based that you'll hear from our residents that is often cited as a strength and match for our program, and there's a list of courses online as well. And then our University of Washington, I think, is on our 36th year of our annual board review course that we offer, and all of our PGY4s have a protected week to attend that course to help with board review at the end of residency. We really do value the resident voice. We are in the complex system of healthcare, and I wish I could do everything, every good idea that our residents have, but we really, really appreciate their involvement, and I particularly want to hear their ideas and concerns and information. We have a high level of autonomy in our program, so I think the people who really thrive here are folks who like that high level of autonomy, but also work well collaboratively as a group, and as physiatrists, that seems very intuitive, but that can be hard to come by sometimes. And so, you know, having that drive, but also knowing how and when to ask for help and helping out the team is something we really value. We have a lot of involvement in service and leadership and are looking to recruit folks who have that set of interests in their background, although it can be in whatever area is valuable or meaningful to you, and continue to have a lot of service and leadership and scholarly activity opportunities, whether that's classic research, or just more broadly scholarship, including QI, clinical applications, et cetera. We definitely have to mention Seattle as an advantage to an interest in the program. Sorry, I'm still in the hospital. We have, you know, exciting co-grades. That's part of our hospital-based program. So you'll hear a little bit more about Seattle in a bit. We are a larger training program that's been around for many decades, and so we have a large alumni network throughout the whole country that is a great thing to be a part of. We have fantastic faculty and kind of every area of study to connect people to or to lead in. And then we're a little unusual in that we have a broader department of rehabilitation medicine, of which physiatry is just one part. So in that same department, not elsewhere, but in our same department, we have divisions of PT, OT, speech, rehab psych, vocational counseling, and degree programs associated with those. And we also have one of the few prosthetics and orthotics programs, and those are all within our department. And so in terms of research collaboration, teaching, faculty mentorship, and networking, we have that as well available. So I would say, though, that the #1 reason is to get to know our residents and work with this amazing group of people. And so we want to spend most of our time letting you hear from them. So I'm going to hand it off to Dr. Carpenter.
All right, thanks, Dr. Zumsteg. So hey everybody, I'm Ben, I'm an R4. I am one of the chief residents this year, and so I was going to start by briefly talking about our didactics and our clinical sites here in Seattle. We have didactic time twice weekly. It's from 7:30 to 10 a.m. All our teaching sessions are led by attendings, and it's all in areas where they have clinical interest and expertise. A lot of our attendings that teach those courses also teach at the UW board review course in our 4th year. We have a resident-run journal club and then also a resident-run quality improvement committee. So we start off in our R2 year with an intro to PM&R course, and then musculoskeletal medicine and anatomy review course, and then into biomechanics, orthotics, and research methodologies. As 3s, we do courses in EMG and amputee medicine, and then as R4s, we have an MSK ultrasound course, which I'm in currently, which is awesome. A lot of hands-on ultrasound, and then later in the year, we have a practice management course to help us prepare for life as a fellow or attending. And then in addition to the residency class-specific courses, every year we also have combined courses with all the classes, 2s, 3s, and 4s, and that's in neurorehabilitation and musculoskeletal medicine to reinforce those topics. So we do each of those classes 3 times with a slightly kind of different focus every year. Another big strength of our program is the really broad clinical exposure we get. So we are the referral center for a 5-state radius. We see patients from Washington, Wyoming, Alaska, Montana, and Idaho. And then we see pathology, which encompasses all areas of our very, very broad specialty. On the inpatient side, we have 4 major sites. We work at the University of Washington Rehab Unit. Those patients, a lot more strokes, brain tumors, solid organ transplant, and then some rare kind of neuromuscular things as well that you'd only see at an academic center. We also rotate through Seattle Children's and do inpatient and outpatient peds rehab there, and at the Puget Sound VA, where we have a very large dedicated spinal cord unit and then a general neuro rehab unit. Another site we work at is Harborview Medical Center, which is Seattle's only level 1 trauma center. And there we see patients with really very acute spinal cord injury, traumatic brain injury, polytrauma. And then in our outpatient clinics, we do all the baclofen pump refills, Botox, spasticity management, and then EMGs are also at all sites. And then on the outpatient kind of MSK side, we do see more acute sports medicine injuries at the Husky Stadium Clinic, which is a cool clinic located right underneath the UW football field. And then we also see just a lot of bread and butter, subacute, chronic MSK, and spine on MSK rotations at Husky Stadium, Harborview, and then at the VA as well. And then we additionally rotate through the UW Pain Medicine Center and then also at a private practice sports and spine group to give us experience with some spine injections, nerve blocks, and gives us some exposure to a private practice setting as well. And I think that having so much clinical diversity really allows our residents to either find the area of rehab that they want to focus on, or establishes a really great experience base to be successful in general practice. And so with that, I will hand off to Lindsay to talk about life in the Northwest and PM&R within the UW system.
All right. Hey everybody, thanks for joining us. just to piggyback off what Ben was talking about in terms of our clinical sites, I think one thing that I really appreciate about our program and have more appreciation now is how well integrated PM&R is in the UW system. I think over the years, our faculty and leadership have worked really hard to get PM&R involved early on in patient care. And I think that it presents really great opportunities for both the patients and us as learners. And we see that a lot on our consult rotations, and those rotations, we have a lot of autonomy. We get involved early in terms of early SCI care, TBI. At the UW, we see patients with cancer, transplant, and then we also have some unique opportunities with amputation patients, as well as other rare conditions, as Ben pointed out. And I think it's a great opportunity for us to learn and be involved in those conversations early. And we also get to take on more of a leadership role and educate patients and families. And so that's what I really enjoy about the UW program and how well respected our program is here, which has been really nice. Outside of the work atmosphere, it's important to have some work-life balance and be able to enjoy the area that you work and live in. And so I think one thing that really drew me to Seattle was that it is a city that has something for everybody. I think that a lot of people love Seattle because of the outdoors, and they know that we have, 3 national parks within 3-hour driving distance, which is really nice to get out and enjoy. But then there's also things that aren't outdoors related that you can do as well. There's a lot of places to eat around, especially with the different neighborhoods in Seattle. Every little nook has its own unique character. And so it's nice to be able to explore the different neighborhoods in the city, explore all the different types of art that we have. There's a lot of cool museums downtown in the Seattle Center. And then we have a lot of major league sports teams here as well. So I know the city is really excited about the new NHL team that's going to be starting up here, but we also have our Seahawks, Mariners, the Seattle Storm, the Reign, and the Sounders. So it's a great city to thrive in. We have a lot of outdoor activities, like I mentioned before, and you can ask anybody in the program. You can find all the gear that you need to participate in those activities. Someone here will have it. And then just doing day trips around to the islands and different areas. So it's a great region to be involved in, and definitely enjoyable for residency outside of work.
Awesome. Thank you, Tucker.
Yeah, and I'll hand off.
Yeah, thanks. My name's Hethel. I'm also a PGY3. Nice to have you guys all join us. So I wanted to touch a bit more on what Lindsay was discussing, sort of just the culture of our program. We are very inclusive and welcoming to all, and that starts super early. Even before our residents come here, we have a buddy system. So our R3s match up with our R2s, and before anyone even moves here, or even if you're already here, before you start the program, we do reach out and make sure everyone's set up for success and knows where they want to live. There are lots of different neighborhoods here, like Lindsay said, and knows how to commute and what to expect. And so you kind of have a go-to buddy right off the bat. But I will say, even after you get here, everyone is very welcoming. On my first days, I remember even Ben helped me out quite a bit. And so you don't forget those things, and you want to pass that along. And I really appreciate that in our program. Other thing we did before you even began here is that happy hours via Zoom. That's something new that our RSC from last year kind of implemented. And it was great to meet everyone. I know often we don't meet the new residents until they get here, so it was a good way to introduce ourselves to everyone and get familiarized with how things are going here. And then once the residents come here, one of the first events we have is our RSC barbecue. It's usually July 4th. Obviously with COVID, some things have changed, but that's usually the first event we have. And then we also have a chairman's barbecue that Dr. Esselman graciously invites us all over to his home, and it's on the water. It's beautiful and great to interact with faculty outside of the hospital. And then one big thing our program is known for is our Whistler trip. It's where we go skiing and snowboarding and just hang out, and as a different area, which I know is trickier this year. It may not happen. So Lindsay and I are coming up with other ideas that we can do via social distancing. So this year, what we've elected to do is a socially distant camping trip in the Olympic Mountains. So being in Seattle is also makes it easier with COVID because there's so much to do outside and lots of great areas to spread out. So we'll keep thinking of ideas for that. And so like Lindsay was mentioning, there's so many great places to spend time here, and it does make it easier on our end to plan events. And then just being a resident here, it's very easy to find a buddy to do anything. A lot of the things that were mentioned, like rock climbing and soccer, things like that, are very easy to pick up with any of our residents. Kickball, and just if you want to grab a bite to eat outside right now. So we are very welcoming, and it's I think a really good program to meet up with people wherever you want to, even in COVID times. So with that, I will pass it along to Katie.
So we have about 2 minutes left.
Okay, I'm sorry. I thought we had a little bit more, but let's do it. So Dr. Smolinski is going to tell you about our internship program, and then I'll put up the contact information for us. We wanted you to have enough of a resident voice to get a feel for us of things you couldn't look up, but we'll redirect you to the website. So take it away, Dr. Smolinski.
Hi, everyone. I'm Katie. I'll try to keep it pretty brief, but I did want to just hit on some of the experience as an R1 in our categorical program. So it's definitely a medicine heavy program, but at the same time, you get a lot of early exposure to rehab. I think you spend about 6 months on either consults or outpatient rotations, and those outpatient rotations include pain medicine, orthopedics, and sports medicine clinics. So you get to go to the stadium clinic. And I think having those experiences as an R1 is really nice to kind of get you introduced to the faculty. And if you have a particularly strong interest in one of those things, there's opportunities for research and early opportunities for sports coverage and things like that. Also with the consults and the outpatient, you have about 6 months out of your intern year where you're not working weekends, you're not on call on weekends. So I think that's something that's kind of balances this, what feels like the pretty heavy medicine months. So you'll do like 4 inpatient, just general medicine wards months where you're on call every 4 or 5 days. And we do call a little bit differently as an intern too. You work for 28 hours on your call night. I'm happy to go into more about that later if you want to reach out. But I will just piggyback on what Hethel said. I think that being an R1, it's nice that you kind of get the early exposure to your colleagues and the other people in your program. I know that even if it wasn't like an organized social event, like Lindsay and Hethel and I, we would watch The Bachelor sometimes together. All of the other R1s in the program last year were all able to make it to the Whistler trip, which I thought was really awesome. And you also get the benefit of being really immersed in the internal medicine program your first year. So I feel like I made so many friends and so many connections early on. I came from Pennsylvania or Virginia, so coming out here and not really knowing anybody, it felt really nice to have that support system. So I'm a huge advocate for the categorical program and being an R1 here at UW. But I'll pause so that if there's quick questions, we can answer those too.
Thank you so much. Well, I know we're short on time, so just to wrap up, I'll say that please reach out to any of us. We have residents who've gone to any fellowship you could think of, and that's available on our website. And we also really welcome your questions either through the website, our chief residents with Karen. We also have a house staff union that there's additional information about that's a great advocate for our ACGME residents. We also invite you to our diversity open house that's happening at the end of August, and we'll post all of this information with the slides and the specific invite to the website, and appreciate the PM&R scholars coordinating to also post those materials. So thanks so much, y'all. We wish you all the best and hope to see you soon.